higher up, even though here we see the inferior olive nucleus just kind of cut a little bit of an angle. But this is essentially the pons, even though we're seeing a little bit here in the inferior olive. Now, and here we get another pathway. So we're still used to seeing the the medial lemniscus here, the tectospinal tract here, and the MLF. But another large pathway that stands up in parallel with the medial lemniscus, and this is the central tegmental tract. Central tegmental tract. And we describe this as a very important pathway in terms of when the reticular formation, which is all these network of cells here that are very important for activating and talking to the whole brain, that all of these neurons communicate with the brain through this pathway, the central tegmental tract. So recall, if we knock the central tegmental tract out here, especially on both sides, then the patient is comatose. Okay, we've got to have this connection between the pons and the brain, the central tegmental tract. Okay, it's a large pathway, pretty easy to identify. Okay, now we get into the biggest cerebellar peduncle, and that is the middle cerebellar peduncle. Remember that the middle cerebellar peduncle is just one pathway, and that's the pathway from the pons to the cerebellum, the cortico-pontocerebellar tract. The brain talks to the cerebellum. It does so by first coming down to the pons, synapsing, and then crossing over. So the middle cerebellar peduncle is entirely the brain communicating with the cerebellum. Okay, so again, so far we've mentioned the inferior cerebellar peduncle, which is spinal cord talking to cerebellum, and middle cerebellar peduncle, which is brain talking to cerebellum. Okay, there are, again, some other pathways that go through the inferior, superior cerebellar peduncle, but only one that goes to the middle cerebellar peduncle. Okay, so in this area now we see the deep cerebellar nuclei. And here we have the dentate. Looks kind of like the inferior olivary nucleus. The embolliform. You recall? Globose and vestigial. So dogs eat good food. Yeah, that's helpful. Then take the nucleus out laterally. Okay, so recall that these deep cerebellar nuclei have to do with very coarse adjustments of movement. Okay, so if we have a lesion here, patients tend to have very, very coarse ataxia, very severe ataxia. The fine-tuned regulation of movement has to do within the cerebellar cortex itself, with the Purkinje cells. All right, so this again is the fourth ventricle right here. We see some choroid plexus.